Hello and welcome to ABA 514, Behavioral Interventions for Autism. Welcome back. I hope all of you have been staying safe and doing your best to steer clear of this virus. We're still in a pandemic, so it's certainly been interesting, and hopefully we have a brighter future ahead of us. Aside from that, I should also acknowledge the changes to the program that both Dr. Perrin and myself are leaving the program. I know for myself, I want to get back to doing clinical work, and I have a couple opportunities that I'm pursuing. So with that, the program this semester is online. This course is online, so I think that'll meet most of the expectations that each of you had regarding at least this semester. Going forward, I can't speak to the format of the program. So let's focus on ABA 514, Behavioral Interventions for Autism. It will be delivered via Blackboard. So this is my Blackboard screen. I'm not sure if it looks identical to yours, but nevertheless, if you navigate to the course, in this Start Here section, I will have this video. So hopefully all of you have navigated here. Going down this menu, well, let's switch to the student view. So according to my student view, you should see something that looks like this. The course syllabus will be here, download it and read it. And all of the lessons, quizzes, and assignments and so forth will be sort of really formatted as my other online courses. So I'll get into this. Let's move over to the course outline. So this course is basically an overview of behavioral interventions for autism. One of the things that I like to talk about when introducing this course is most of the behavior analytic content that is covered in this course will be familiar to you. That is when we talk about prompting or reinforcement-based interventions or concepts like imitation and so forth. All of that should be content you covered. The unique aspect to this course is all of the content will be exemplified via interventions or assessment interventions for individuals with autism. Autism is really a subspecialty within behavior analysis. It's really a small part, even though there's a lot of focus on ABA and autism. Within the larger field of behavior analysis, autism is just one part of it, and there are many parts. That said, there is sort of a unique literature that goes along with applied behavior analysis and autism. And you'll see maybe some new authors that you haven't read before. So some of the research is clearly maybe taken from Journal of Applied Behavior Analysis, but the authors may not be as familiar to you because these are authors that really dedicate all of their work and all of their focus to the area of autism. So with that, let's talk about the course syllabus. So I'm not going to read everything, but the course is online. As noted, I will maintain some office hours. We're going to, basically my office hours will be, if you email me, I will try to make an arrangement to set up office hours. That said, because I am essentially an adjunct at this point with the university and working during the day, most of my office hours will be in the evening. But that said, I could probably make some exceptions here and there. The textbook, as noted in an email previously, is out of print, and that the bookstore notified me of this. So if you could find it used, I highly recommend it. It looks something like this on the cover. And it's written by a parent, Gina Green, who is a prominent researcher in the area of autism, and then Richard Fox, of course, who is a prominent behavior analyst. The textbook really I should say it's not a textbook. It is a book that is geared to parents or teachers of individuals with autism. But in that, it's really accessible content and it gets right to the core of each of the areas that we're going to cover. So in that sense, I think it's worth having, particularly if you're working with individuals with autism. There may also be some readings from the Handbook of Applied Behavior Analysis, which, as you know, is available through the library. So again, the primary goal is really just to expose you and cover the behavior analytic literature for individuals with autism. And I try to arrange a course where it kind of covers the lifespan. That's hard to do. It's beyond the scope of any course, but certainly I focus on some early intervention, just some general school-based services, and then some special areas like feeding disorders, but all into adulthood and vocational training. The basic format of the course is sort of described here. I'll cover it in this video lecture, so I'm not going to read that. Obviously, there are quizzes and exams, and then there are going to be assignments where you will be drafting what I'm going to call teaching programs. They're essentially behavior protocols, and you've all written behavioral protocols before. Teaching programs are very similar. Sometimes there are different formats to them, and I'll talk about that in the throughout the semester. The grading scheme here is in this grid. Not going to read through the university policies. You could read through those, but essentially the course is arranged here. I'm going to bump back and forth between Blackboard and the course syllabus. So starting this week, all of the content for the course is posted, so you could essentially work at your own pace. But starting this week, you will read Chapter 1 from Maurice Green and Fox, and then there's some websites that I want you to explore, and I'll get to that content shortly. So some website links here talking about the assignments and how they're arranged in week 2. There are more readings. Some of these readings are posted to the folder, right, if they're difficult to get online. Other readings, you can certainly look in the syllabus and see where to access them, right? So the Norman and Dallery article, the link is here. But I think I believe I posted them in the folder, so we'll look shortly. Then starting in week 2, you have some quizzes. So there aren't quizzes every week, but there's certainly kind of something to do every week, some activity. And then getting into week 6, the teaching programs will begin. So the teaching programs are arranged in a way that I need to ensure you've covered some content before assigning them, right? So teaching 1 involves prompting strategies. Well, we don't cover prompting strategies until week 5. So I wanted to make sure you get those. So you'll see the teaching programs are sort of assigned later in the semester. So let's get into week 1. After reviewing the syllabus, I want you to start in week 1. The content for this week will be fairly light. All I would like you to do is explore 2 websites. The first one, Autism New Jersey, and the second one, the Association for Science and Autism Treatment. These will be 2 websites that are invaluable to you as a professional, but I often recommend them to parents as well. So for Autism New Jersey, be sure to explore all areas of the website, but particularly focus on the public policy section to see what is new or what's up and coming in terms of public policy for treatment of autism. And then the second website is the Association for Science and Autism Treatment. This is a great website. We'll explore it a little bit more next week. Definitely look at the treatment sections in terms of focusing on what works, what doesn't work, what's untested. Really great website. Essentially, if you go to the website, they have a variety of resources. It is largely directed for families, but they also cover professional issues and general information. And if you contact Autism New Jersey, they'll send you literature and so forth. So it's a really fantastic resource for parents, professionals, and just the general public. So what I would like you to do is spend some time on this website exploring the different menus, understanding autism, prevalence, diagnosis, and treatment. They'll talk about prevalence within New Jersey, of course. Information services, this will list various service agencies and organizations. Education and training. As many of you probably know, they do hold an annual conference. In fact, this year the conference will be virtual. And the conference is heavily behavior analytic, even though they cover a variety of other topics related to autism. So it goes beyond behavior analysis and gets into other areas such as just educational services, medical issues, and so forth. So from there, one of the areas where I'd like you to spend a little more time is in public policy. Because again, this is an advocacy site or agency. So what they do is they advocate for quality services for individuals who have autism. And a lot of those advocacy issues impact the practice of behavior analysis. So for example, Autism New Jersey was instrumental in ensuring that insurance agencies pay for our services, right? So that was a big step forward. They are also involved in licensure for behavior analysts, and as you know, or as you should know, the bill was signed by the governor basically just as the COVID-19 pandemic hit and locked everything down. So there has been no movement on enacting the licensure. So, more news on that to come, but this would be a place to look for that. So if we look at public policy, a variety of introductory remarks, and then some of the related issues, funding for services, severe challenging behavior. I'm actually involved in this work group here, licensure workforce. So you can find all that information here. Going back up, legislation. So again, various committees that work to ensure that quality services are being recognized by the state and that it gets enacted into law. Okay. So, just take some time to look through and educate yourself on these issues as it relates to autism in our field. The next thing I want you to do is to review the Association for Science and Autism Treatment link. And this organization is essentially made up of a variety of professionals, a few behavior analysts and medical professionals and so forth. And they are essentially advocating for science and autism treatment because, as you may or may not know, there is a lot of pseudoscience in the area of autism, meaning individuals who are purporting to be professionals, but their treatment approaches have no evidence. So we're going to talk about that in the next week or so. So clearly a lot of information about pseudoscience will be covered in the next couple weeks. But this site is a fantastic resource, again, for us as professionals and parents. So quite a variety of menus to go through. Some of the ones that I find most interesting are here in research and treatment. So they have a variety of resources, bookshelves, videos, and so forth. But the treatment is one of the menus I spend a lot of time on. So if you go into treatment, there's a few more menus. This one, learn more about specific treatments, we'll actually be looking at in a little more detail next week. But just to orient you to this section, here's where the list of all the interventions that are available for autism, not just the ones that are proven to be effective via empirical research, but other ones that perhaps are not proven to be effective or don't have enough research to support their use, or that just is untested. And the reason for that is the organization is educating professionals and parents on what interventions are effective and what interventions are not effective or even dangerous. So next week, I will, if you look at the course schedule, I ask you to look into these sections in a little more detail, and there'll be some quiz questions related to this. So let's start with the easy stuff. What works? Okay, so nothing surprising here. Interventions based on applied behavior analysis, early intensive behavioral treatment. So this would, again, indicate or educate professionals, non-behavior analysts as well as behavior analysts, some of the summary research findings related to ABA's effectiveness for autism. And they list a variety of specific interventions, some of which we're going to cover in this course. So this is really a great resource and fascinating. I think you will be surprised at some of the recommendations for interventions that are untested. So we'll talk a lot more about that next week. And then they have a newsletter. I subscribe to it. I typically will forward it to all the students in the program. So you've probably visited this site before if you've read any of those newsletters that I forwarded. But again, please spend time on both the Autism New Jersey website and the Association for Science and Autism Treatment website, and just spend at least an hour or so looking through and reading some of the content. Also this week, you'll be reading Maurice Green and Fox, Chapter 1. And the textbook that I assigned it's an older textbook. It's not really a textbook. It's a book that was written specifically for parents, but the editors, Maurice Green and Fox, I'm not as familiar with Catherine Maurice. I believe she is a parent, but Gina Green and Richard Fox are behavior analysts who have done a tremendous amount of research in the field. But the reason I select this text is, one, because it is written specifically for parents, and it in that vein, it helps us as professionals understand, one, where parents might be coming from when they have a child who is diagnosed with autism, but two, it gives us another perspective about how to talk about our technology, the technology of applied behavior analysis. So when we're reading through these chapters where they're talking about various treatments like prompting and prompt fading strategies, it's written in such a way that a parent should be able to understand it. And I think that will help us professionally in conveying what we're doing to parents. So Chapter 1 is really just, again, a parent's perspective. In fact, it's written by Catherine Maurice. And I think the reason I like this chapter is, again, just because it educates us as professionals. If you haven't already been doing so in your service delivery, at some point you will start to think about what the parents are experiencing during this process, right? Our main role is to advocate for the individual who we're serving, the individual that's diagnosed with autism, but inevitably we take on a secondary role of educating the parents with respect to autism, effective interventions, ineffective interventions, and our approach to treatment. So spend some time doing that. If you have questions, feel free to email me and reach out. Next week, you will be reading topics on pseudoscience, science, and effective treatments, Maurice Green and Fox, Chapter 2. You'll do some more exploration of the ASAT website. And I will have a recorded lecture and PowerPoint. So you'll have access to those notes, but also you will have access to me lecturing.